So as I've mentioned, perimenopause technically starts from the age of 35, when cycles can change. They might become heavier, irregular, longer, shorter. You might experience some other symptoms. And the typical fluctuations of estrogen and progesterone are generally more varied and slightly more unpredictable. Bit of a roller coaster ride for some women. Generally, you shouldn't get any bleeding in between periods. So if you do start to experience that, then get that checked. And some women, the closer they get to perhaps sort of their late 40s, 50s, you might start to get some anovulatory periods where you don't actually ovulate. So your ovaries can still produce estrogen, your lining of the uterus can get thicker and thicker, but and that can result in heavier, more irregular periods as well.
Sorry, are we on the wrong slide?
Oh
I
yeah,
thought it was up.
yeah. There we go. I quite like the picture of the bear creature. I think it sums up most people's energy levels, I think, at this stage. Thank you. Yeah, thank you for that. Also, keep a check on any increased frequency of bleeding in between periods. So have your smear tests as well, because that can keep a check or indicate any changes in cervical cancer or onset of cervical cancer. So good to be aware of. For any considerations to training in sort of perimenopause stages, particularly if there's heavier menstrual bleeding, iron levels might be lower, so there might be some anemia, which can then have a knock-on effect to so fatigue, and impact on energy levels and training as well. So those are things to consider and maybe speak to a GP about if you have any concerns. There are quite a lot of symptoms of perimenopause, which I'm going to read out to you. Again, these do come from Michelle Lyons. You won't necessarily get all of them, thankfully, but there are symptoms that I think a lot of women probably put up with and necessarily shouldn't. So here we go. Symptoms of perimenopause. The joy begins. So they can include hot flushes, night sweats, bloating, digestive disorders, increased body odour, particularly from the armpit, bone fracture, joint and muscle pain, breast tenderness, libido changes that go up or down, dental or gum issues, dry, itchy skin, pain or irritation with bowel movements, recurrent UTIs, urinary urgency or frequency, anal leakage. And I said to someone the other day, 1 in 5 women over 40 can experience anal leakage. Constipation, heaviness or bulge in the vagina, so sort of prolapse type symptoms, vaginal dryness or itching, pain or bleeding with sex, difficulty orgasm, hair loss, weight gain, heart palpitations, headaches, migraines, disrupted sleep, itchy, twitchy or restless legs, decreased energy, tiredness all the time, rumination or catastrophizing, panic, irritability, brain fog, difficulty getting or staying asleep, decreased concentration, anxiety, decreased confidence, depression, decreased joy, rage, irregular changes in periods, flow, pain or timing, dry, irritated tissues, clitoral or labial shrinkage. I'm not entirely sure how that's measured. And also finally, bladder leakage. So as I mentioned earlier, some of the postnatal issues of stress urinary incontinence or urge incontinence, common but not normal, but also can be present in perimenopause and postmenopause if they're not tackled. So if you're looking at coaching considerations for the perimenopausal women, that's quite some list of things that women might be battling with quietly in the background, and they do often have slightly wider implications to social, physical, emotional impacts on women, and can be barriers to participating in sport as well. So there are lots of things that we are probably programmed to just accept as normal and that we get on with. But a lot of those symptoms can also be managed and improved if the overall kind of care is quite an individual approach. Again, looking at the foundations of hormone balance, and then any other kind of management medically, possibly with things like HRT or topical estrogens, for example, to help with quality of life as well. Coming on to the menopause. So when there's a lot of stuff in the news about menopause, or has been certainly over the last few years, but actually a lot of that really relates to the previous slide, so the perimenopause, which is from the age of 35 up to, on average, 52, which is when most women have a year or 12 months without a period. So retrospectively looking back, that is when you say, oh, okay, now I am postmenopausal, and then you're kind of living or tackling the impact of aging from that point onwards. So generally you're then dealing with a drop in hormone levels unless HRT is a management option for symptoms, and hormone levels really become lower but more settled. Some women might experience some sort of carryover of symptoms from perimenopause, but they may not. So again, it's quite individual. What one woman will experience will be quite different to someone else. And again, it's really knowing what your norms are sort of throughout your menstrual years, antenatally, postnatally, perimenopausally, so that then you can monitor changes when you get into the postmenopausal stage. So yeah, menopause is really the 1 year that you don't have any periods. Perimenopause is the sort of 10 to 15 years leading up to that, and then postmenopause from that point onwards. The decline of your estrogen levels can have an effect, as mentioned earlier, on your heart cells, the endothelial cells, and that is why often postmenopausal women have an increased risk of dying from heart attacks or heart disease, and it's actually the biggest cause of death in women, not breast cancer, primarily because the presentation is different in women, so it's not picked up as quickly. Often it can be as sort of instant as death, but symptoms can present as shortness of breath, feeling or being sick, or back or jaw pain. So in a man, it might be the kind of typical left-sided arm or chest pain. So it's something to be aware of with symptom presentation in women. It's not something that's widely talked about, but can be something that women in that postmenopausal age might experience. The muscle mass in our bodies starts to also decrease. Approximately 3 to 8% a decade after the age of 30, if no sort of regular exercise is completed. And that rate of decline is even higher after the age of 60. So the strength training elements of hormone management and general fitness are quite key to either maintain or improve muscle mass in our bodies. With women postmenopausally, they're also twice as likely to get dementia. It's a really happy list of things that we experience postmenopausally. Again, primarily because estrogen is brain protective, and when that level drops, that can have an influence on prevalence of dementia. So I don't know that that's as high if women are then on HRT, so the hormone replacement therapy, but certainly in those without, it's something to consider. Training considerations for the postmenopausal women. 1 in 4 women over 50 will experience a gluteal tendinopathy, so a bum cheek muscle tendon tendinopathy, again due to that reduction in estrogen levels. And a similar for shoulder rotator cuff issues. So for anyone who does triathlon or swimming here and is into that postmenopausal age group, that's something to be aware of in terms of the repetitive nature of swimming on the rotator cuff muscles. There's also an increased risk of metabolic diseases, so your high blood pressure, hypertension, type 2 diabetes, and that can be due to changes in body composition and that increased body fat that I mentioned that can be hormonally active as well, plus loss of lean muscle tissue. So your HRT obviously is an individual consideration. It can be very good for replacing estrogen, and the consequences, excuse me, of experiencing lower levels of estrogen. But also you need to have a look at quality of life considerations as well. So bone health is quite a big factor if you're not on HRT, with risk of fragility fractures from osteopenia or osteoporosis being quite high. But we can prevent these issues as well. So on a slightly more positive note, from all the things that women can experience, with various ways of managing things. So good lifestyle, nutrition, diet, hydration, and exercise management as well as we age. So you still want to challenge the body, but be mindful of changing symptoms.